This study shows us that the benefits of mammography are less than we had hoped for, and the potential harms are greater than we had anticipated. This study reported that a large population of women that are randomized to get screening mammography and a good breast exam versus those that don't get the screening mammography, that there's no difference whatsoever in subsequent mortality.
Does this study give you pause about recommending mammography?
This study adds to an accumulation of data. Over the last 5 years, we have been seeing more data from multiple large studies showing at a population level that we're not seeing the benefit from mammography that we had hoped. The more you look, the more you find with screening mammograms, and we are unfortunately potentially detecting a lot of tumors that the women would have lived with for their entire lives and it would have never harmed them. And this is called overdiagnosis. This is a screening test, and so they see abnormalities and they ask the women to come back. In other words, they'll send a letter or they'll call the woman to say, "Dear Mrs. Smith, don't worry, but an abnormality was noted. It might be cancer. We need you to come back for additional testing." The great majority of those episodes don't end up diagnosing cancer, and so we call those false positives. Once a woman is diagnosed, we don't know if she's the one that is potentially benefiting from mammography or if she's the one that our treatment is so good it could cure her regardless of whether she was diagnosed early, or if she's one of those women that was overdiagnosed and we're going to overtreat, which can include mastectomies, radiation therapy, chemotherapy. I don't think women realize that in the United States, we are the only country in the world that encourages women to start at age 40 and to go every year. There are some other countries, such as the UK, that start screening in the late 40s, early 50s, and have women go every 3 years. I don't think we also realize that we're spending about $8 billion every year to pay for all of the breast cancer screening. And the fact that there's a major scientific paper that was published showing that we're not getting that benefit that we all had hoped for, that's concerning. This particular study was done in Canada. Some have questioned whether the quality of the mammography itself was older and we now have better imaging. Some have questioned the quality of the randomization of the women. But others have said that this is it actually is the only study that they actually looked at the quality of the mammograms. And it's one of the only studies that was done in the modern era in which we have better treatment. My hope, though, is that women will take this as just one piece of the puzzle. There's a lot of statistics, a lot of numbers. It's very frustrating because the numbers are interpreted by people differently. I think you have to go beyond the numbers, though. Every woman has certain values and preferences, and you make decisions based upon your head, your heart, and your gut. And I think that since your head sometimes can't wrap around some of the data, and in fact we actually don't have adequate data to a certain extent, women have to make this decision themselves, and they sometimes have to think about how they feel in their heart and their gut, what's important for them. And I don't want physicians or national organizations to pressure women into making a decision that isn't right for the woman.